I am Dr. Aileen Collier. I am a palliative care nurse and a researcher.
My name is Kamal and I am from the Bhutanese community.
My name is Dalia Al-Brazi. I'm from Syria community.
Good morning and namaste. My name is Mohan Bhattarai. I'm working as a volunteer in the community.
My name is Isaac and I'm from Ivory Coast.
So my name's Kathy Jeps and I'm a nurse consultant specialist in palliative care.
My name is Lydia. I'm from Burundiani community as well.
So I'm Greg Crawford. I'm a palliative care physician and a researcher, and we're doing a project to try and understand what is brilliant care at the end of life, and particularly we want to understand how we can better provide end-of-life care for several communities.
The Brilliance programme is an ongoing programme of research where we're looking at the conditions for what goes well for people when they require palliative care, as well as not so well.
So we were able to take film and find out from patients and family and staff what is it that they see is brilliant care. This is a real life way of obtaining what is it that goes well in health, and it's honest.
When we started thinking about which communities we might work with, we looked at how many people from different communities there are in these Northern Adelaide suburbs.
So this topic, the palliative care topic, is quite interesting. It is very important in terms of community perspective, because the palliative care is totally new for our community.
In Bhutan, because our elderlies, like whether they are sick or they are aged, when they are taken to hospital, in the last stage, hospital says that you take them home.
When we use the word palliative care, can I just ask, what is your understanding? What does palliative care mean to you?
Yeah, palliative care is more than caring and comfortable.
About comfort?
Yeah, about comfort to the person who has a disease.
I think there is actually a lack of the concept of palliative in most, if not all, the African communities. I think if that service is going to be provided, I think that the doctors and the nurses need to explain what is involved in the palliatives. Because I think, from my own view and our own discussion in the community, a palliative is seen as administering a medication that gradually diminishes the person and the person will die slowly.
So that's not a good sense at all.
I think it is a good thing if people explain properly. It need, as I said, it's a new concept. It needs really proper community education.
The main issue for the Syrian community and many other communities in that sort of similar circumstances is the explanation and the accessibility. Basically, these are the main issues. So the concept of palliative care that's available in Australia, it's not a known or well-developed concept in Syria and many other countries for that reason.
As a nurse trying to understand what those things that are important to that person, we as nurses and a palliative care service can support them the best way we can. But we have to understand their culture.
So this has helped me to provide some sort of information to the community about palliative care. And
culture should not be a barrier. Boxing people in different preset boxes, I think it can help sometimes for certain sort of services, but it will not be a way to go to manage things.
We need to listen. We profess as palliative care clinicians that we're good listeners. The key line, and I borrow this from the disability sector, is nothing about us without us.